When you're using math, applying rules, visualizations, algorithms, using machine learning to get these really, really big sets of data working for you, you can really get insight into what's happening biologically, health-wise. This is where we get the field of bioinformatics, scientists analyzing these huge amounts of data really fast, really accurately. Now, we already have these vast amounts of data kept in a lot of our medical records. Big data sets, real-world data, and it's not always pretty or polished. This is where our third and final summer research student enters the picture. Vaidehee Lanke earned her bachelor's degree of science in bioinformatics. Then she went to McGill for her master's in epidemiology. Now she is back home in Saskatoon studying medicine. And Vaidehee Lanke is our guest today on Researchers Under the Scope. Hi, welcome to Researchers Under the Scope. I'm your host, Jen Cannell. Our guest today is Vaidehee Lanke, who spent this past summer working with epidemiologist Dr. Nazim Muhajarine. Their research project looked at some large data sets around perinatal mental health and opiate use disorder, looking at how mothers are feeling before, during, after they give birth, and how and where that connects with opiate use disorder. Vaidehee Lanke and I sat down to talk about it this fall. Here's our conversation. Vaidehee, welcome to Researchers Under the Scope.
Thanks so much for having me. I'm so excited to be here.
I'm excited to hear about your summer research project. What was the question that you set out to answer?
So the question that we set out to answer was, what is the association between opioid use disorder and perinatal mental health conditions? And our work is rooted in the context that opioid use disorder is tied to very adverse and poor health outcomes, both maternally and fetally. So maternal death, stillborn birth, poor fetal growth. And so the lab I worked with Dr. Muhajarine and the Saskatchewan Population Health and Evaluation Research Unit is part of a bigger Canadian perinatal opioid project. And so we're working across 5 provinces, including our own, to track national opioid use to see what the social determinants are and then what the health impacts are both maternally and fetally. And so my slice of this project was trying to look at the mental health aspect of it, because we've seen that substance use disorder and mental health conditions have an association between them. So individuals who have mental health conditions like mood disorders, anxiety, depression, they are at higher risk of substance use disorders and vice versa. And then we've also seen the co-occurrence of mental health conditions and substance use disorder in pregnancy that leads to higher risk pregnancies and poor health outcomes, both for the parent and also for the infant. And so what I really wanted to study was, how does the co-occurrence of mental health conditions and perinatal, opioid use disorder, how does that change over time in our province? Specifically, what is the mental health conditions that are impacted, their severity, the opioid use type, and also when that happens during pregnancy. So is it before, during, and after? And really leading to evidence-based medicine, to what we can do to provide solutions for it.
I have so many questions relating to this. And when we say opiate use, what are we talking about? Opiate use disorder means...
So opioid use disorder is a disorder that's made by clinical diagnosis, and it takes into consideration many different factors, including the type of opioid you're using, the behavioral pattern you have with that use, withdrawal, tolerance, and really the impact on someone's life, and the functionality piece of it is really critical, and that's made as a clinical diagnosis. And so in our study, we looked at data from the Health Research Data Platform of Saskatchewan, and specifically their discharge data sets and ambulatory data sets and medical billing data sets. So anyone that would have opioid use disorder would be classified within those administrative data sets, and then we could use that data within our project.
And the opiates that the people in the study might have been using would include, I'm thinking, is it fentanyl or codeine? What counts?
Mm-hmm. Anything that would be an opioid. So we're more specifically looking at the outcome of it, so opioid use disorder, but any opioid that someone might have consumed and then ended up in one of those administrative data sets, we would have access to that data to include in our population level study. So yes, the ones you mentioned, codeine, would be included, but we're more looking at that outcome of opioid use disorder.
Once you brought the data in, what methods did you use to sort of try to sift through it?
I want to take a moment to talk about bringing that data in and what a large partnership this is for us. So it's with the Saskatchewan Population Health and Evaluation Research Unit, led by Dr. Muhajarine and his wonderful team. So they've worked in partnership with the Health Research Data Platform of Saskatchewan, and really trying over the summer was establishing that partnership and bringing that data into the project, because these are very large administrative data sets that require many different steps to ensure that we have proper access to that data, that patient confidentiality, privacy is respected and protected, that our technology platforms and the coding software is set up. So that access piece is really big and requires a lot of human resource and development into it. And I think I'm grateful to have been witness to that process. And so the second part of my summer was trying to start to distilling what does this data mean. So a big part of it is, I think, for us merging these different data sets together, so we have a cohort of people that we can then study. And to start that off, we did a little pilot on one of the data sets to flesh out the code, to kind of see what are the initial trends look like with mental health conditions and opioid use disorder in perinatal populations. And we've just wrapped up that pilot project, and now we're going to head on to that bigger piece of merging all the three data sets together.
How would you say the pilot project went? Perfectly according to plan, or any hiccups?
Research is like a winding pathway, so perhaps both is the answer to that question. We, at the end of the day, were able to get to the part where we're able to see our trends from 2016 to 2024 for our research question, but it wasn't without its fair share of learning curves. When it comes to code, sometimes you're poring over it and it's that little comma or semicolon that makes all that difference. But then it's working, in partnership with bigger teams to access that data and then to bring meaning to that data, because you have these numbers and you're trying to figure out what does this mean and what does it mean going forward. So many lessons are learned, and I think that's really helpful for a pilot, because then we can apply them for our bigger project.
What would you say, looking back at the summer, were your key takeaways?
So many. I think, first of all, this was a dream project for me because it brought together all my different worlds. So I come from before medical school, the worlds of epidemiology and public health, and now medicine. So this was a project right at the intersection of it. And I've always wondered, what does work like this look like in the future for me? And I think I kind of, got a little glimpse into what my part in the intersection of health looks like. And I think the second part is any research project I've always been grateful for to be a part of, because it builds a life toolkit. And it's not only the quantitative, qualitative data skills, very important, but it's that critical thinking piece, how to look at massive amounts of data and make sense of it, how to evaluate evidence for validity, how to apply the scientific method. These are critical, crucial skills that I think are needed for everyone, but especially in that role when I think of being a physician and working with patients. And it gives you an appreciation for all the human effort and dedication it takes to do research. It is immense. And I think you gain that appreciation when you're on that side of being that researcher. And now when I walk through health science, where we have our classes all day, every day, you realize that in this building, there are on every floor across campus, people are doing incredible research, and that research is already shaping medicine and will continue to shape the medicine that myself and my colleagues practice in the future. And it's super important that we take the time to learn about that research, to learn about that scientific method, and vice versa, and that we build those bridges, because we as researchers and as medical practitioners impact each other's work and can impact each other's work so profoundly. So I see myself helping build those bridges in the future.
Yeah, I was kind of wondering, from the actual hands-on sort of hospital side of things, the clinical side of things, to the epidemiology and public health side of things too, let alone the data sets. Where do you see this really having value into the future?
I think epidemiology and public health are they're the backbones of medicine, because they help us understand the distribution, the determinants behind any sort of health event. So take something like this project that I worked over the summer, trying to look at, what kinds of opioids are being used? Where are they being used most? How across the years has that opioid use changed? And how is it connected to something as important as mental health conditions? Or epidemiology and public health can help us answer, what are the social determinants of health? So what factors are driving certain communities to experience certain health conditions? And they can also be reasons that we look at, okay, this area of workflow and health needs more improvement. And once we've put in an intervention, what is that intervention doing? Is it helping? And how can we better improve that intervention? So it helps us answer all the questions that I think distills down to evidence-based medicine and providing that foundation for it. And so this summer has been almost like a peekaboo into how evidence-based medicine is formed. And again, the human power that goes behind it, the science behind that goes behind it. And I think for me, it has been reaffirming that I want to be a part of that bridge between the worlds of epidemiology, public health, and medicine. And I'm really excited to see where that takes me.
What's ahead for you? And can you see yourself going back into Dr. Muhajirine's lab?
Yes, I'm there. I have never left the lab. So I'm going to be there to complete out this project. And the impact of the work really matters to me and being able to support perinatal health. And I think our bigger vision with my project is being able to support interventions, especially when do these interventions need to be implemented? Is it before, during, or after pregnancy? And how can our work support the co-treatment of both mental health conditions and opioid use disorder? So that impact really matters to me, and I'm excited to see the carry out of this project. And I think beyond this project, two things reflecting on this project and my year in medicine have been, one, really trying to build that bridge out between researchers and medicine. Sometimes it feels like we're in our two worlds that are very connected, but, surface level in silo. And I want to be a part of building those bridges and developing those relationships. And the second is, how do we take what we're doing here, not only in this lab, but all the labs that are on campus, and take the work from the University of Saskatchewan and bring it out to our communities and make that work accessible. That piece really matters to me. So podcasts like this, I thank you for your work because they're super important in building out those bridges. But I'm thinking writing and the creative arts, so that our communities have access to the research that we're doing, and that we can also learn from them. And I think building those partnerships out in the future is really the way we shape research and allow it to reach its full impact.
Behind each paper that is published and behind all of the evidence and the data that goes into them, there are so many stories and there are so many humans who benefit. So I'm just really pleased to have you here on the podcast and to be sharing with us. Thank you so much.
Thank you so much for having me. This has been wonderful.
Vaidehee Lanke is in her second year of medical school. This year, she won the Dean's Award for her work on the Pan-Canadian Perinatal Opioid Use Surveillance System. Now, you've heard Vaidehee Lanke's name before because she won the Governor General's Academic Medal going into the U of S. She won the Schulich Leaders Scholarship. She was a finalist for the McCall-McBain Scholarship. And before she went to McGill to earn her master's in epidemiology, she was the University of Saskatchewan's most outstanding graduate in bioinformatics 3 years ago. She's one to keep an eye on. Researchers Under the Scope is a presentation of the Office of the Vice Dean of Research at the University of Saskatchewan's College of Medicine. We record and produce this podcast on Treaty 6 territory, and we pay our respect to the First Nations and Métis ancestors of this place, and we reaffirm our relationship with one another. Thank you for listening to this show, for being a part of science. I'm your host, Jennifer Cannell. Thanks for sharing your ears with Researchers Under the Scope.